For this next session of the Future of the American Child Journalism Training, we're going to be focusing on yet another issue that has captured quite a few headlines in America recently, and that is of the issues of gender-affirming care for lesbian, gay, LGBTQ individual teens specifically. We're seeing just such a broad spectrum of policy decisions, local community responses, family challenges in this area. And it's such a broad range that I feel journalists need to understand some of the underpinnings. They need some tips on how to, as I say, avoid the navigating the partisanship minefield that is attached to covering this issue. So that's why we're pleased to have a journalist who has actually literally been on the front lines of this kind of coverage, coming from Arkansas. Andrew DeMillo is the State House reporter for the Associated Press in Little Rock. And as he will explain to you, Arkansas was the first state really to get into this specific topic in terms of making it a public issue. So, Andrew, please come and start your presentation for us.
Thank you very much, and thank you all for having me here today. I've really enjoyed hearing the presentations so far. As Rachel said, I'm the Capitol Correspondent for the Little Rock Bureau of the Associated Press, and I've been there since 2005. And when I started at the AP, basically kind of the instructions I was given was, be prepared to write a lot about school funding, about tax policy, budgets, highway funding, kind of the bread and butter issues. Something I was not really prepared for was writing about LGBTQ issues in general, but specifically transgender health. And that's something that's taken a good amount of my time over the past 2 years, and kind of want to walk you through what's happening in Arkansas, what's happening nationally, and some of the tips that I wish I had known, and want to take any questions that y'all have. And wanted to start with this is the first story I wrote about the gender affirming care ban in Arkansas. I'm not completely sure. But this is from 2 years ago, March 2021. And this was about the ban that Arkansas eventually enacted. And the story, it's an adequate story. It's your typical 2 quotes and a vote kind of legislative coverage, and it's something that, looking back on it, I wish I had approached differently. And you kind of will talk about some of the reasons why. But it's just a very straightforward story, almost the same way you'd write about a tax cut going before a legislative committee. And this is a story, especially from what we've seen the past few months, that requires a lot more attention, requires a lot more work on the front end. What happened in Arkansas was 2 years ago, Arkansas passed HB, I forget the number, 1750. It was the Arkansas Save Adolescents from Experimentation, or SAFE Act. Uses the rhetoric that you hear with a lot of these bans right now. And it passed easily. Arkansas's legislature is predominantly Republican, so it got through with not a huge amount of debate, and went to Republican Governor Asa Hutchinson. And a surprising thing happened. For those of you who don't know, Asa Hutchinson was our last governor. He is running for president right now, and he is not a moderate by any stretch of the imagination. He signed nearly every abortion bill that went to his desk. He signed, and he has been outspoken on social issues in the past. But on this, he had signed other restrictions on transgender youth, including transgender sports bans, like we're seeing in other states right now. But when this went to Hutchinson's desk, there was a little more uncertainty on what was going to happen. He had expressed some concerns, and he did a surprising thing. He vetoed the legislation, and he didn't do it quietly. He had reporters come to the governor's mansion, where he walked through the concerns that he had about this legislation. Hutchinson had sat down and talked with some opponents of the bill, had talked with members of the transgender community, about their concerns. And the concerns they had raised were, he referred to this as an extreme bill, and said that he would have signed something more narrow that would have focused on surgery, because gender-affirming surgery is not offered for minors in Arkansas. And he would have supported something like that. He also had concerns about the fact that Arkansas's bill, very similar to some of the other legislation that we've seen, did not grandfather in people who are receiving the care right now, which that is especially problematic because one of the other parts that it bans is it also bans doctors referring patients elsewhere for care. So those were, a couple of the big concerns he had about that. In Arkansas, a governor's veto is pretty weak. It takes a simple majority to override a governor's veto. So he knew that this was going to get overridden, and it happened almost immediately. So what happened was, in May 2021, the ACLU sued the state on behalf of 4 transgender youth and their families and 2 providers. The law was not going to take effect until late July. About a week before it took effect, a federal judge held a hearing, and at the end of the hearing, he blocked Arkansas's ban and had said that allowing it to go forward would cause irreparable harm. He had raised a lot of the same concerns that you heard from the governor and about the law. So this has been winding its way through the court. August 2022, the 8th U.S. Circuit Court of Appeals, which is considered a pretty conservative appeals court, upheld the temporary order blocking the law. So late last year, there was a trial, a 2-week trial, and the judge took under advisement, did not rule from the bench. To this day, we're still waiting for a decision. So I've joked with my colleagues that sometime today or tomorrow, since I'm here, they're going to issue the ruling. So if you see me look at my watch and you'll run off, you'll know why. But we're still waiting on that. An interesting wrinkle that happened in the meantime is the state's current governor, Governor Sarah Huckabee Sanders, signed SB 199, and that was legislation that is aimed at reinstating Arkansas's ban. And it does that by making it easier to sue providers of gender-affirming care for minors for malpractice. It extends the statute of limitations and basically puts restrictions that they would have to follow if they did offer the care. Experts on malpractice law and the providers have said that it would be nearly impossible to get malpractice insurance with these restrictions. And it's interesting because there are similar provisions in some of the other gender-affirming care bans that we've seen. Arkansas is unique because Arkansas already had a ban that passed, and this was a standalone piece. So this doesn't take effect until I think July 31st. I think it's likely that we'll see a similar lawsuit challenging it on the same grounds as Arkansas's ban. So where things stand right now, and I think a lot of y'all already know this. This has been what LGBTQ advocates say is a historically bad year in terms of legislation. They have seen hundreds of bills that have been filed, especially bills targeting the rights of transgender people. And the gender-affirming care bans are an area where we've seen the most rapid movement on this. As of today, and I use the modifier at least because this keeps changing so much. We've got at least 16 states that have enacted laws banning or I want to know about the Ghirardelli chocolate. So as of today, unless something has changed today, at least 16 states have enacted laws banning or restricting gender-affirming care. I'm not going to read the whole list there, but many of you all in your states have these laws in effect that have been passed. Some of them are not necessarily in effect yet, I did not break that down in terms of which ones are currently in effect. The bans have been blocked by judges in Arkansas, as we've talked about, and in Alabama. To give you an idea of how quickly this has moved, before this year, there were only 3 states that had enacted laws banning or restricting the care. Now, 3 other states, Florida, Missouri, and Texas, have banned or restricted the care through administrative orders, regulations, rules. Missouri, as you know, went the furthest with restrictions from the Attorney General that would have affected both minors and adults. A judge has temporarily blocked those restrictions. In Texas, Texas's governor had ordered child welfare officials to investigate reports of children receiving gender-affirming care as child abuse. The state had opened some investigations. A judge has effectively blocked those investigations. So there's a lot going on, and chances are this issue has already gone on in your state or is about to happen in your state in some way. And some of the tips that I wish I had known about or thought about going into this. And the first one, and it seems pretty simple, but familiarize yourself with the research and standards of care for gender-affirming care. And the reason why I say that is there is a lot of misinformation out there, and a lot of people who present themselves as experts. But there are tons of people who actually are experts. The American Medical Association, the World Professional Association for Transgender Health, you've got the Endocrine Society, you've got the American Academy of Pediatrics, but also you've got the benefit of having at least two major cases where you've got filings in this. The Arkansas and Alabama cases are both in federal court, and you've got the filings not just from the attorneys, but you've got the friend of the court briefs from these associations that go by, point by point, what the medical practice, what the medical consensus is on these. If any of y'all have a PACER account, you can get them. If you want me to send you copies of any of the documents, please reach out to me and let me know. As well as you've got the Missouri case, you've got the Texas case, and these are all very similar points that are coming up. And if you have a state that has enacted a ban, there are going to be very similar arguments that are going to come up. So this is a good way to prepare for covering those as well too, as well as familiarizing yourself with what proponents of this ban are arguing, because the arguments in favor of them are not that different from state to state. Also familiarize yourself with AP's style book entry on transgender coverage. I'm very proud to work for AP, because of the work that they do with their style book in terms of updating things. The AP style book there is not written in stone. It's fluid, and there are things that have to be updated. And this is an area where terms change, where the understanding changes, but also there's expanded explanations too. But also discuss your own publication style with your editors, and if it differs from AP style, have a discussion. Why is that? If there are parts that are outdated, I think the AP style book gives you some good guidance on it. The most important part, and this was going back to, So going back to the story that I did 2 years ago. Like I said, and not to look down on a story I did, but it was a big thing that was missing was the voices of people affected by these bans, and that's something that see a lot of the coverage in this, and it's difficult, covering this. If you're covering this in a legislature, you've got 500 things going on that you're chasing, so you don't really know how to balance this all out, but also you go into these hearings hoping, well, there's going to be testimony on both sides, and so I'll be able to get it from that. The problem that happens in Arkansas and other states is usually what happens with these presentations is you have the proponents of the bans get an unlimited amount of time to talk about it. Opponents of the bans, the debate gets limited, where they can only talk about it for 1 or 2 minutes. So you may have family members talk there. You may have transgender youth talk about it. But imagine talking about a major medical decision or a major medical issue in your life in 1 to 2 minutes. I can't. And so that's why it's important to, get the voices beforehand in some way. And this requires building sources, going to events, going to rallies, introducing yourself to witnesses at hearings, even if you're not covering them, just to say, just to have that contact. Advocacy groups, obviously, especially at the state level. The national groups are dealing with so much right now that it really is important to find the local level people to talk with. And these are some examples. I think AP has done a really good job in covering this. And I'm talking about my colleagues in terms of the way they've covered this. But 3 examples I wanted to point to. The first is treatment ban creates uncertainty for trans youth and families. And this is a story I did after Arkansas's session a couple years ago. And it's really a story that I wish we had done when this debate was happening. It was still before the ruling occurred, but it was really a chance to be able to sit down with families, sit down with transgender youth, and also talk with providers, and kind of walk through and say, okay, tell me what your experience has been like. And with providers especially, I talked about kind of the misinformation that's out there, or even just kind of misconceptions. There are some people who honestly are under the impression that this is kind of treatment on demand kind of thing, where there's not a process with it. And it really helped being able to talk with doctors and say, okay, walk me through what do they go through, but also talking with the families and ask what they go through. And this helped both for coverage, but also in terms of my own understanding of this. And so I think a story like that really benefited, and I was really appreciate getting a chance to work on that. Second story is anxiety, fear, Phil, West Virginia Transgender Health Clinic. And this is from Leah Willingham, who's an excellent reporter in West Virginia, and really gave a good description of what happens in these clinics, what are they going through as this ban proposal is moving through. But really, it's kind of like what I talked about the first time, like I think helps kind of dispel a lot of misconceptions that people may have about this care. And it really worked, the way she did it, and I thought it was really well done. A third story is a little broader, and this was something we had happen with our legislative session this year, where, and you all may have seen the video of this, when there was the debate over SB 199, the malpractice bill. There was a pharmacist from Little Rock who testified, and she was testifying about patients that she's seen who are transgender, and their experiences with gender-affirming care. Well, this pharmacist also happened to be transgender. She was not talking about her own experiences. But she mentioned that she was. And as she is testifying, one member of this committee, a Republican, asked her. I'm not going to repeat the question, but asked her about her genitalia. And it was a pretty shocking moment. I've never heard a question like that in a legislative committee before. And when that happened, we included that in our spot coverage. But I talked to my editor at the time and said, we could do just a story on this one exchange, but I think this is emblematic of a larger problem, because there were other examples that we had come across of what's happening when transgender people are appearing before committees to talk. They're being misgendered. They're being asked pretty insulting questions. And so it was a chance to kind of really look beyond just one experience to see, overall what's happening when transgender people are doing something that, is a right people have, is, going to the legislature, talking about their rights. And, the concerns that people have about, is this going to have a chilling effect on people coming out and speaking out about these? And it came together really well. We had different experiences. Even had an experience with transgender youth, I think in Missouri, who was asked a similar question. And talked with the mother of transgender youth in Texas, who kind of talked about concerns she has about this, and how that motivated her to go testify even more. And that's an area to kind of talk about is, I think there's areas to look at beyond just the issue itself, of just the rhetoric that happens with these, because so much of this is being driven by the rhetoric. We did a similar story after the Nashville school shooting, because you had kind of similar anti-transgender rhetoric that was going out there and asking people how is that affecting them. So some do's or don'ts, and I wrote some extra ones down here too, so I may go off script. But the reminders for first is seek out voices of people affected by these bans, and this includes transgender youth, includes their parents, includes medical providers, and even if it's even for spot stories that may seem incremental, because even if you're doing something out of committee, there's a way to elevate that story. You're doing something on a basic court hearing that may not have the voices of the people in there. There's a way to elevate that, and a lot of that takes planning, because especially if you're in a pretty conservative state where these things are moving through, you have a chance to prepare for it as well. One thing I did want to say is, obviously, be sensitive. Transgender people, their families, they're facing a lot in terms of threats. They're facing a lot in terms of just the type of rhetoric they're facing, as we saw. When you're interviewing them, make sure they understand that their name is going to be out there, and make sure find out what their level of comfort is with that, and what are they comfortable with being out there, especially if it's someone who hasn't dealt with the press before, because it's a very touchy area right now. And I would say, make sure you kind of walk through and say, okay, I'm going to mention this. Is this okay? And mention that this is going to go on air, or this is going to be online. Are you okay with that? Second part is talk with experts who understand the process, standards of care, and not even just for stories. Just see if you can get experts who just willing to just sit down, even if it's for background or off the record, just to walk you through to make sure so you've had that conversation, you've had someone kind of walk you through everything, and the next part, and also that part will help you with the next part, which is fact check claims made about the care. There's a lot people don't understand, and a lot of times their claims and rhetoric, they're just kind of tossed into stories without really an explanation of, well, this is why this isn't true. And the other part of that is, just avoid false balance. Don't include false blames just for the sake of having the other side. That's a big problem that comes with coverage right now. Don't include a quote that has misinformation just for the sake of having a quote from the other side. And include the national context. This is something that's not happening in a vacuum in the States right now. There are plenty of organizations that are tracking this that give you a good idea of what is happening at national level. AP, we've been tracking this, and it is definitely a task to keep track of these too. So the number keeps changing all the time. And a couple resources I definitely would recommend is Erin Reed, she's a journalist and an activist who's been tracking this issue. Her Twitter feed she has the amount of energy that she has is amazing, because she's like tracking just a huge number of legislative hearings. So she'll post video from it. She has a newsletter that you can subscribe to. It's a pay newsletter that's almost kind of a daily roundup of what's happening on this front in different states. And not to refer you all to other news organizations, but in terms of getting an idea of the sentiment right now, Washington Post had a great poll recently, looking at polling among transgender adults, and it's really well done. Produced some great stories, but also it's great, great for context on this on national level. And for don'ts, don't treat it as a dry policy story, because it's not. This isn't a budget policy. This isn't tax policy, which obviously don't treat those as dry policy either. But there's a lot that people don't understand, and writing it as a story that's populated by a whole bunch of people with rep or sen before their name doesn't help people understand that as well as hearing from real voices. Don't leave out what medical groups say about this care. Don't let it be driven by just what's happening from policymakers. The medical groups have a very clear position. and don't only write about this issue when there's legislative action or a court hearing. We're kind of winding down where most legislatures are wrapping up. Of course, I think we're getting into a period where there's going to be a whole bunch of litigation to follow. But there's going to be a period in between those, and there's a lot of enterprise to be found for tracking this. And the last one, which you're told this all the time anyways, don't assume. And it means don't assume don't assume you know everything. Don't assume that because the story has been written that you can't write it again in some different way. There's still many different ways to approach this, and so assumptions are very dangerous in this. Story ideas, very just kind of generally, exploring the impact the bans are having on children. Kind of like what we saw with the story we did after Arkansas's ban passed, and we've had other stories. And this is a stressful time it's a stressful time being a kid anyways, but a stressful time especially now, where they're having to decide what to do in order to still receive the care. If they're high school age, are they making decisions about college based on this? And that's something where you're seeing a lot of families who've lived in a state their entire lives looking at having to uproot. What impact does just the threat of these bans have on these families? So that's one area. The impact it has on providers. I think Leah's story did a really good job looking at that. But even beyond that, does banning care in one state create a strain on resources in other states? This is very similar to what we saw with abortion bans. How are some providers going to be able to deal with this in other states? And also going back to the rhetoric, you've got medical providers they've had to deal with bomb threats. They've had to deal with threats to their personnel. What impact does that have on them? Is make it difficult in terms of staffing, in terms of recruiting. And the other part of this is how would these bans get enforced? And this is something that you can look at beyond gender-affirming care, because this issue comes up with the sports bans. Who's going to be in charge of figuring this out? And what are any unintended consequences from them? Sponsors of bill may say, no, it's not going to. This unintended consequence isn't going to happen. But a lot of times there's uncertainty on some of these. And really, this is an excellent area for helping the public understand this. And that requires things like fact checks, explainers, Q&As, even just kind of like basic, where things stand to help people understand how this fits in everywhere. And as we talked about earlier, looking at the rhetoric surrounding this, there's different terms that are thrown around that people use. What kind of impact does this have on transgender youth? So that's a lot of the areas. Let's see. And also, because I think earlier there's a question about kind of the negativity bias. What about states that are going in the other direction? We're seeing states that are welcoming gender-affirming care, doing more to support it. Looking at the states that aren't the states that aren't banning is also a good way to look at it as well too. And I think that's everything I got. But any questions y'all have?
A lot of the criticisms about media in recent years, decades, have been that, they're all liberal. They don't take into consideration enough the conservative point of view, et cetera, et cetera. And I don't want to assume anything about you personally, but when it comes to your reporting and your weighing the credibility of a source, listening to their position and having to decide, well, they got a point, even if you don't agree with it. How do you handle that sort of navigating the ability to know who to put in the story and who has a valid point and whatever.
I think one of the main things is if somebody's saying something that's just flat out false, they may have a good point, but if it's false, you don't put it in there. And this is, you've got, every major medical organization saying one thing about this, and this, that's a good guide for what to include in there, including that context. I think you still want to figure out some way to explain what is the argument that they're making on this, and you need to either is there an argument in there that is more opinion based than fact based, or if they're saying false things, you have to just flat out just say it's false, because there is one of the arguments against this care is a lot more opinion based, which is that children aren't ready to make this kind of decision, and that's a lot more of an opinion-based thing rather than some of the other claims.
Now, you work at the State House and you talk to the policymakers or whatever, but in terms of the sort of general zeitgeist in Little Rock or in the communities, what kind of languaging, or what are you hearing the community say about whether they agree with the policymakers or whether they don't?
It's a mix, and Arkansas is a very, very, very conservative state. Little Rock is not conservative. Little Rock's one of the few kind of pockets of Democrats in the state. So you do hear, if you talk to people about it, you hear kind of similar rhetoric to what the lawmakers are saying. When you get outside Little Rock in different parts of the state, and then it's kind of a which caused which. Is it are they parroting what they're hearing from lawmakers and conservative commentators, or are they the ones who are pushing the lawmakers to do this?
Any questions? Let's get the mic going here.
Hi, my name is Jackie Hendry. I work with South Dakota Public Broadcasting, another state that has dealt with this extensively.
Yeah.
I wonder if you can speak to in how you approach covering some of those like inappropriate or blatantly transphobic remarks that public figures are making, because that has been a difficult conversation in our coverage of whether or not we repeat that by the virtue of it being said by a public figure, or whether we don't.
The way we approach it is, if it's as bad as that hearing, it's a story on its own. You also hear the other comments that are used where it's referred to as mutilation, or referred to as experimental, or referring to someone who is transgender as biological male or biological female. We don't put that in the story. It's not that they don't get kind of free reign to be able to put that out there. But then it's kind of a case by case thing on whether it merits a story on its own.
Hi, I'm Erin Chandang, a freelance journalist. One of the things that I do, I'm also a contributing editor for PolitiFact for the national team.
Oh, great.
And I was discussing our session with our LGBTQ reporter at PolitiFact and our researcher, both of them who are heavily into covering gender-affirming care legislation and LGBTQ issues. And they each have questions for you.
Okay.
Our reporter is wondering, this issue of finding credibility on both sides. She says that it seems like to believe in the existence and humanity of LGBTQ people seems like in itself a partisan issue nowadays, partisan position.
Yeah.
And so as a journalist who's focused on the facts and not on advocacy, is there a way to report on that issue in a balanced way? I can pause before the second question.
Oh God, please, yes, do. So basically the question is, do you cover the whole way it's approached right now in terms of you've got people who are just questioning whether trans people should exist?
Yeah, I mean that in itself seems to be a partisan position.
I think that does merit a story. Like you see, not in terms of giving credibility to that, but looking at why is it being approached that way? Because you've seen some commentators refer to transgenderism, trying to equate being transgender with an ideology. So it's, I think it's covering it more as what I talked about, like covering the rhetoric, but not necessarily lending credibility to it.
So the second question from our researcher, Karen, she's wondering if there is some university or an organization that's known for producing demographic stats with regard to LGBTQ, gender-affirming data. So data on, for example, like numbers of transitions, numbers of centers, who are the authorities in the field that we could look for data and research?
And I'll say I'm not a complete expert on it, so this is kind of just based on the experience I've had. The Washington Post survey, I think, was really useful in terms of getting a sentiment, because it was very very recent. In terms of numbers, there are a lot of different groups that reach out to see what they'd say. Like I talk with Human Rights Campaign, National Center for Transgender Equality, have been really good. One group I didn't talk about that I think is really useful for looking at the impact that discussion about these bans has, the Trevor Project, when it comes to impact that has in terms of the suicide and bullying that members of the transgender community face. I think that they have some good resources too in terms of numbers.
Your questions?
Hi, Bonnie from Texas Public Radio. Recently, a colleague of mine up in Dallas had done a story on this subject, and we had a Zoom afterwards. She was quite shaken up because she tweeted out the story, and you know how that goes, right? We open ourselves. Well, we expect as journalists to be a target in some ways, but it's really ramped up over the last couple of years, starting, with COVID and the anti-vax crowd, and now with the elevation of this topic. What is your advice to young reporters like my colleague who are even just afraid to tweet out their work because they're going to receive all kinds of really targeted hate?
Yeah, and I can relate to that. That's this is, I can't think of any other topic where I get the most. My timeline lights up when I write about this, and it's not nice comments usually. I think a big part of it is talking with editors beforehand to figure out what resources do they have in terms of online safety, because I think that's a really big concern right now. My own personal approach to it is I've kind of got to the point where if I have a story coming out dealing with these issues, I still tweet it out. I want people to be able to read it. I try to avoid being on Twitter for the rest of the day because it's not good for my mental health dealing with that. But I think talking with editors, talking with your news organization beforehand on online safety, mental health resources they provide. I don't engage in debate with people online about it. I'm very old school, where I like using Twitter, but I don't get in fights on Twitter. I don't know anyone who's won a Pulitzer for getting into a fight on Twitter. I've known plenty of people who've lost a job for getting into fights on Twitter. So there's not much to really be gained by it. But I can definitely relate it as something that I think anytime you write about this is something you need to be prepared for and need to have that conversation beforehand.
Hi. My name is Jen Christensen. I work with CNN, and I'm also on the board for the National Lesbian Gay Journalists Association,
Okay.
LGBTQ Journalists Association. Sorry, we updated the title. My question for you, one thing for data, the Guttmacher is great out of California. They have a lot of data, and it's reliable and useful. My question for you is, we've seen in some cases coordination of groups trying to get legislation passed.
Mm.
Are you experiencing that in Arkansas as well? These groups we've seen in some states where they're also working on the same abortion stuff, the same kind of conservative rhetoric in each of these states. And a lot of them tend to be like white supremacy kind of groups. Do you have that same? I don't know Arkansas very well.
And I don't know on the white supremacy part, but like it's very similar. You have a lot of the same groups doing this, and if you look at it, like these are the wording on these bills is very similar. They're to the point that they're citing the same research and things like that. So that's definitely something that came up. Arkansas, when this came up, though, was there wasn't really any incident that sparked this in Arkansas. Arkansas, they just started pushing for it, and it happened during a session where you had a lot of social, like culture wars bills getting through, to the point that even Hutchinson, who's was very conservative, even saying, "This is we're getting a lot here, and I'm normally a culture wars person." So you even had that concern. But I do think it is a lot of the same groups.
I guess sort of like there's this other, I don't know if narrative is the right word, but just like there is all this other stuff happening in real time at the same time as these attacks within the medical community as they debate the standards of care and they revise their updates, and then internationally there's these big debates in other countries as they're doing it. And I'm wondering like how you think about how to incorporate like what's happening in Europe and sort of within the medical associations and the debates that they're having right now.
I don't get into like the like how much the debate changes over time. You do see some of the same European countries cited, but it's usually not the complete story of what's happening there too. And so I try to be very, very cautious about including any of that in there. And you still have overwhelmingly just the medical organizations still opposing these bans and supporting gender-affirming care if it's done appropriately.
So I wanted to ask you about how you find families who are willing to talk about this and what sort of duty of care you have. And I'll tell you why. I did a story about Black maternal health I interviewed the folks back in 2018. And I went to Ferguson, Missouri. And Missouri had high numbers, whatever. And I spoke to a woman who said that she had her first child at 13, got pregnant again quickly thereafter, was on her way to the abortion clinic, stopped by the Ferguson police, harassed, and told if she didn't pay some outrageous sum of money that she would go to jail. And so she wound up giving him the money that she would have used to get the procedure. And long story short, she had her second child. But I built a rapport with her just to tell her story, and she shared that with me. And then her son read the story and felt like, oh my God, she was ready to abort me. It caused irreparable damage, and it haunts me to this day. So I wonder for you, when you're seeking people to talk about what they go through, their vulnerabilities, their fears, their worries, what kind of a duty of care do you have if it's somebody who's really raw or really feels vulnerable? Would you make yourself say, no, we better not include them, or how do you navigate that?
I think a gut feeling is definitely a good guide if there's something that you feel would not be appropriate to have in the story. I also, whenever I've done the interviews, I've tried to be very very careful at the beginning to say, listen, I know we're talking about medical decisions, and this is very personal. And I'll say, if there's something I ask that you don't feel comfortable talking about, you tell me. But also, I will say, do the usual checks of like, okay, what's your name? How do you spell it? And I'll say, are you okay with this, with your full name being in here? Are you okay with me saying you live in this city, or do you want it to just be this state? And just try to be very very careful. A lot. Some of the people I talk to, they've dealt with media before, because a lot of the people who talk about this, feel comfortable and they're okay with it. But if it's people who haven't really dealt with media, I try to be very, very cautious about it, because it's kind of like what I talked about in terms of the pushback reporters will get online. That's only a fraction of what these families and these kids have to deal with as part of their life.
Question here?
Thanks. Anna Spurry with the Kansas City Star. I guess the follow-up to that is, when you are interviewing a family that hasn't been in the media before, has not already been testifying, has not really had this public-facing moment, do you give them any kind of heads up or warning that, if their name is out there, they could be facing a lot of blowback, harassment? What you experience on a much smaller scale as a reporter, they're potentially opening themselves up to this. Is that a conversation that you've had? I've had moments where I've, kind of tiptoed that line, being like, this could be really difficult, if you talk to us. And this seems like one of those scenarios where it could be similar.
And I haven't had a conversation specifically that way. And but I think that's a good idea to have that, to say, are you, but I'll also explain to them too. I'll say, this is going out on a national wire. This is going to be this is going to be seen by a lot of people. So I've had that conversation, but I think it's fine to have even more of a conversation to say, are you okay with this? Are you worried about any kind of blowback or things like that? Because you don't want to scare someone away from talking, but this is a very different type of subject too. Yeah, that might be a conversation to have, or even have with the parents as well too, to say, do they understand that that this is going to be out in public? I think for a lot of these families, they've had this kind of conversation before in different ways, but I think that'd be a good conversation to have.
Jen,
Sorry, I made a mistake. I said Guttmacher because I have abortion on the brain. But I meant Williams Institute.
Okay.
Williams Institute has great data. I apologize. My question is a practical one about the AP style guide. We have LGJ as a supplement to it. Jeff, who's on your committee, is on ours as well. But I wondered, how often do you update it? Is it on a rolling basis, or is it every once in a while? I know it evolves all the time.
It's based on my inbox, and Jeff knows this a lot better than me, and he's an editor I work with regularly. It's based on the inbox and the updates I get on. It's pretty regular, and it's an ongoing conversation, because it's not just on terminology, but it's also how to approach the story too. And it's been incredibly helpful. And also there are times where I've realized, I've been using outdated language, and so so it's helpful as a reporter just going through that.
Hi, Piper Hutchinson, Louisiana Illuminator. We're based in Baton Rouge. Just last week, I covered a story on a bill to ban gender-affirming healthcare for minors. And one thing, I kind of struggled with was two detransitioning activists came and spoke to the committee. They've kind of been making the circuit, going on Fox News, going to these different state legislatures to basically advocate for these bans. And I was wondering if you had any thoughts on how to be sensitive, to these, fragile young people who, had a bad experience, while still kind of pointing out that these are basically right-wing actors.
I think you fact check the claims about detransitioning. AP did a really good story with our medical writer, where she went through how rare it is, and it was a bunch of different medical experts, and kind of going through what we know, what we don't know. I think if you include them in there, I think you have to point out what's known, what's not known about it, and also point out that they've been testifying in other states. But that's definitely an area that fact check is needed within the story, not separate.
I have sort of a 1,000-yard view question for you. I know you're a journalist, and I know we are all taught to be, dispassionate and objective, whatever you want to call it. But to me, this feels like religion is so wrapped up in this whole conversation. People's religious beliefs about Adam and Eve and all of that, whatever. And our country is so fractured on so many different levels. So again, I know you're not a soothsayer or whatever, but where do you see this heading in terms of the next few years? What does it feel like in Arkansas in terms of this is a done deal? It's going to happen.
I'm definitely not a soothsayer. I don't know, but it does feel very similar to what happened with abortion restrictions, where you think a state can go as far as it can, and then they come up with another restriction, and I'm talking beyond gender affirming care. So I think this is just going to be an issue that is, at least in state houses, is going to be just a regular part of the beat, in the same way that keeping track of these various abortion bans. And it's kind of like I talked about when like the at least 16 could grow to at least 19, and just trying to keep track of this is just it's a bear to try to do.
And what advice would you give to a journalist who says, this is too much of a hot potato? I don't know if I can, whatever. I mean, how does it build your strength? What does it do for you when you delve into this kind of coverage?
It is a hot potato. It's very difficult, and it's something that I'm still learning as I go along. I still have a very big learning curve to go. But I think it also helps you for dealing with just about anything in terms of covering this. But also, it's important for people to understand. This is part of a job is helping people understand the world around them, so they can make good decisions.
Great. There's one more question.
I guess sort of journalism related, in the sense of as you've been covering these things, how has the AP as an organization responded to maybe trans employees being scared for their livelihood or their future, or you have colleagues who have trans children. I had colleagues in Texas who had trans children that were scared for their children. Has there been any sort of institutional response as you've been covering these things, since AP has a presence in all of these states? Has there been any sort of discussion about people that live in those states or their children that may be sort of subject to the same kind of attacks that you're covering?
And that's going to be one where I'm going to plead ignorance in terms of what all they've done. I will say AP has been a very good news organization to work for, and I think this is something that they would be very concerned about if an employee did not feel safe in the state they were working in, or didn't feel safe for their employees. But I'm not sure what all discussions they've had kind of higher up about it.
You talked about the soothsayer aspect. There is sort of and then they came for me aspect to it. When you think about how do you enforce a bathroom bill, right? Mm-hmm. Is it the way you look? Am I going to have to wear a dress into a bathroom to be allowed to go in, even though I'm assigned biologically female at birth? How do you enforce that? Or gender genitalia checks for girls on sports teams, that kind of thing. Are those things that you've heard about in Arkansas, or things that you see perhaps coming down the path, stories that that are on your radar per se?
I've not heard about anything yet with the athlete ban. And Arkansas just passed a school bathroom bill, and it's also another one that won't take effect until July 31st, because it's 90 days after the session. but I think that's going to be one of the big concerns, especially with that, is how are they going to enforce that? Who's going to be in charge of it? One of the interesting things that happened with our session this year was there was a much wider bathroom bill that was proposed that would have gone even further than North Carolina's, and would have someone would have faced charge of trying to remember that, like, it was like indecency with a child if they were in a bathroom, and there was if there was a minor present. The interesting thing that happened with that is that got through the Senate and went before House committee, and you actually had some Republicans on the committee asking kind of those very questions of how do you enforce this? What are the mechanics of it? And they scaled it back where it's not really a bathroom bill anymore. But it was kind of those same questions, brought up by people that you thought would have voted for it, who were kind of going through the mechanics. And so I think that kind of comes up, and that came up with we had a drag show bill that was proposed that also got scaled back, and it was kind of for the same reason of people asking, well, how do you distinguish between this and this? And so those are some of the things that come up, especially when you report on them and point out what it can affect. That helps people understand that some of these go beyond what the sponsors of these bills intend.
Well, now that you've been welcomed into the NPF fold, I'm hoping you will make yourself available to these journalists should they be faced with having to report on these kinds of stories and need a bit of advice. So let's show our appreciation to Andrew DeMillo for joining us today. Thank you so much.